Welcome to the first edition of Issues at Heart. We plan to use this technology to bring you up to date on important issues that directly impact our mission and strategic goals. Today we're looking at the Family Smoking Prevention and Tobacco Control Act. What is the American Heart Association doing to help pass this important legislation, and what impact will it have on our future? In just a few minutes, members of our advocacy team will shed some light on these issues. But first, let me explain why we're committed to this bill and what it means to our mission. Tobacco use remains the single most preventable cause of death in the United States. More than 400,000 Americans die each year from tobacco-related disease, with heart disease, stroke, and other cardiovascular diseases accounting for more than one-third of these deaths. And it's not just smokers who are at risk. An estimated 35,000 non-smokers die from heart disease each year because of exposure to secondhand smoke. In spite of the overwhelming evidence of how tobacco smoke kills, these products are among the most unregulated on the market. Believe it or not, macaroni and cheese is subject to more regulation than tobacco. Now, how crazy is that? Manufacturers are not required to disclose the nicotine content of their products, which allows them to secretly make cigarettes more addictive. They deploy marketing campaigns to attract young people to smoking, and they make misleading claims about light and reduced risk products, even though there's no such thing as a safe cigarette. So what does this mean for us at the American Heart Association? As you know, our 2010 impact goal is to reduce coronary heart disease, stroke, and risk by 25%. One of the indicators we're using to measure our success is a reduction in the prevalence of smoking by 25%. Obviously, the FDA tobacco legislation would help us meet that goal. But you may be surprised at how many of the other indicators could also be impacted by a reduction in smoking. For example, we know that cigarette smokers are 2 to 4 times more likely to develop coronary heart disease than non-smokers. By decreasing the number of people who start smoking, we reduce their risk of developing coronary heart disease. This legislation will help to significantly decrease the number of people who start to use tobacco. At the same time, it will increase the number of people who quit using tobacco, saving countless lives and bringing us one step closer to achieving our mission, building healthier lives free of cardiovascular diseases and stroke.
Hello, I'm Madeline Solomon, AHA Tobacco Team Leader. Joining me today are Derek Scholes, Government Relations Manager, Suzanne Folks, Media Advocacy Director, and Jerry Schwab, AHA Advocate. Derek, break it down for us. What exactly is in this bill?
There are several provisions in this bill. One of the most important is that this bill would restrict the tobacco company's ability to target youth. So it's going to ban advertising within 1,000 feet of schools. It's going to ban candy-flavored cigarettes, which tobacco companies use to attract kids and get them interested in smoking and get them hooked. It's going to reduce advertising in convenience stores that kids, of course, frequent every day. And it's also going to restrict advertising in magazines of high youth readership. There are a number of other important provisions in the bill, one of which is that tobacco companies, manufacturers, are going to be required to tell the FDA exactly what additives they put in their cigarettes. And beyond that, the FDA are then going to have the authority to require them to either remove them or to reduce those additives.
And can you imagine finding out, if you're contemplating beginning to smoke, that in a cigarette there could be ammonia, formaldehyde, arsenic? I mean, that's enough to deter, I would think, most young people from smoking.
Each cigarette packet will have large warning labels. They're going to be graphic. They're going to be at least 30% of the packet, front and back, and up to 50%. So the public is going to be no doubt whatsoever that smoking is bad for you.
Why the FDA?
Well, the FDA is the only agency that really is capable of doing this. It's the one with the scientific expertise that can analyze a product, look at the data, and see if the two line up.
What is the AHA doing to pass the legislation?
Well, the association has been very active over the last several years in trying, again, to educate Americans, policymakers, about the dangers associated with smoking. And so the association has been doing a number of things on several different fronts, including working with our grassroots network, the You're the Cure grassroots network, which it consists of hundreds of thousands of volunteers and advocates across the country who are meeting with their representatives in Congress to urge them to write a prescription for a healthy heart to help pass this bill.
And we do that. And I think also what Suzanne reflected on was getting to the point where you do contact your senator or congressman through however means you want to do it. But I think you have to bring to that person the urgency of this matter. For the first time, we're doing community education, public awareness for this specific issue. When we have Lobby Day and we go up to the Hill on Lobby Day, what you will see from the survivors especially, or from the volunteers, as well as the staff, but more volunteers and survivors, is what they bring to any initiative, and specifically this one, is their passion.
I understand you have a personal connection to this issue.
Yes, I do. Unfortunately, I do. I had a heart attack at 34, but I actually started smoking in my 20s. And really didn't understand the downsides to it. And at that time, there really wasn't a lot of public knowledge as to what smoking was or how bad it was for you. So I smoked until the age of 34 when I had a massive coronary, and I lost about 30% of my heart muscle that day. What happened was I had some contributing factors, but 75% of what happened to me that day was strictly due to my smoking.
Why is it so important to pass this bill now?
We have a record number of co-sponsors. It's got more momentum in Congress than it's ever had, and I think this is the best shot we've had for a long time.
Obviously, this is an important bill. What can individuals do to pass this legislation?
Well, as we said earlier, I think advocates or anyone could just contact their representative and also join the association's You're the Cure grassroots network. We hear from members of Congress and state legislators all the time that they want to hear the personal story. And in this instance, in trying to help pass the Family Smoking Prevention and Tobacco Control Act, we're urging our advocates on the grassroots network to contact their representatives and urge them to write a prescription for a healthy heart and to do something in this session in trying to get the bill passed.
Thanks to all of you for being here today. And now I will turn it over to Cass.
Clearly, the tobacco industry has had the upper hand for far too long. How can an industry responsible for 150,000 cardiovascular-related deaths each year have no federal oversight? For the sake of public health, it's time for the Food and Drug Administration to step in and regulate these deadly products. Here's how you can help. If you haven't already, join the You're the Cure network. Visit americanheart.org/you'rethecure to sign up now. Also, please call or email your senators and House representative and ask them to support this bill. It's time to act now. Our lives and our children's lives depend on it.